What is an A-lift? You hear all these terms from time to time, and it's really confusing. So an A-lift means an anterior, going from the front, lumbar, that's the area where I'm at, interbody fusion. Interbody just means that disc space at L5S1, L45, L34, we always name there where we're working at between the vertebral body above and below. So an A-lift at L5S1 means that we're going through the front and we're going to be putting a cage from the front. Now, imagine, if you will, you're laying flat on your back, and I use a vascular surgeon to help me who makes the approach. Through that approach, I basically have access to the spine. We take a cage very similar to this, and then we actually insert it from the front in a front orientation. Now, the great thing about an A-lift is simple. It's big, it's robust, and I have a lot of ability to actually remodel the spine and put it back where God wanted it to be. And I'll tell you, one of the primary reasons why I do it is because of the cage size. This is an example of a T-lift. And we'll have a whole nother separate video about T-lifts, but this is the difference between a T-lift and an A-lift. And you look at the volumetric size of one cage versus the other. And the idea is, if you're walking on a sheet of glass, would you much rather be walking on it with flat loafers or high heels? Well, the answer is simple. You want on flat loafers because you spread the surface area. The more you spread the surface area, the better and more stable the spine becomes.